Thank you so much for joining us. Welcome to Face to Face. My name is Kelly, and I am the Parent University Coordinator that serves Network 6, the University Village Parent University. And welcome to today's session with the Office of Student Health and Wellness about health forms. So your presenter for today is Ali Santak. And Ali, would you like to introduce yourself?
Absolutely. So my name's Alexandra Sontag. I'm a nurse practitioner. I work in the Office of Student Health and Wellness here at Chicago Public Schools. My background is I'm a K-12 CPS grad. My whole family works for the district, and now I work here too, doing a lot of stuff around general health, getting kids connected to care in a COVID world, a lot of our COVID response stuff. So I have an undergraduate degree in cell and molecular biology and African diaspora and African history from Tulane in New Orleans. I have a master's degree in clinical nursing leadership from Rush and a doctorate in nursing and family practice from Rush as well. I'm really excited to be here and kind of go through some of these questions. I am joined by a very special guest, Ms. Cynthia Lopez, who I am extremely grateful for. She is an amazing school nurse who has worked in CPS for a while now, and I will let her introduce herself as well.
Hi, thank you for that, Ellie. So my name is Cynthia Lopez. I go by Cindy Lopez. I am a school nurse. I've been working for CPS actually 20 years this year. I'm a certified school nurse. I've been in elementary, preschool programs, elementary schools, and I'm now at a high school as well. So I run the gamut of all CPS nursing. What else? I think that's about it. So I'm here also with Allie to support any questions. And
So once again, my name is Ali Sontag. I'm a nurse practitioner in the Office of Student Health and Wellness here at Chicago Public Schools. I'm joined today by Cindy Lopez, an amazing school nurse who's worked with us for many years. And I'm very grateful for her partnership in this on this presentation. So our mission here in the Office of Student Health and Wellness is to remove health-related barriers to learning and advance health equity here in Chicago. Our office does a whole...
Ali, I'm so sorry to interrupt, but our interpreter is saying if you could please slow down just a little bit. Sure. She's having a hard time. Thank you.
No problem. Our office does a variety of things, everything from health promotion, such as school garden, sexual health, recess, mental health, to health information, to health services such as vision and hearing and dental exams in our school-based health centers. Our Children and Family Benefits Unit enroll students in Medicaid and SNAP. Our COVID response does contact tracing and other COVID-related supports. And newly in our office is nursing. So very glad that our office gets to expand and fold in nursing into some of the things that we support. So we're here to talk about also the whole child. The whole child is a model from the CDC that puts the child at the center of this wheel, and that we know that every student in every school should be healthy, safe, supported, challenged, and engaged. And we do that by making sure they are well-resourced. So thinking about not just our students, right, the physical environment that they're in, but also how we're engaging with their families, if our employees are healthy, both physically and mentally, looking at the child in this complex wheel. And we know that by doing this, we can eliminate some of those barriers to health in our schools. So this is very much in alignment for this one with our health services as well as our family engagement. So the objective of this presentation is to teach you about some of our health forms here at CPS. We know that sometimes there's a lot of paperwork, especially the first 2 weeks of school, and we want to kind of take some time to break down what the forms mean, what they don't mean, what we need, what's required, and then answer any questions you may have. So our health forms are really important because it allows us to communicate, kind of closing that gap between health services the student receives at home and what they need in school to be safe and healthy and learning, right? And so it's through this communication between the schools and the parents and caregivers and their medical provider that we're able to make sure that we have all of the information required so that we can make healthy decisions for our students in schools. Cynthia, you want to jump in here with our lovely medical booklet this year?
Yeah, so every year there is a student and school booklet that comes out, and I believe it's in at least English and Spanish. There may be some other languages as well. And it kind of goes through the general forms that are needed. Clearly, some of them are more. Some of them may seem very simple, but it's so very, very important that we have the accurate emergency information. Oftentimes, if this is not asked for on a yearly basis, what might be in our electronic system may be the phone number from a year ago, 2 years ago, no longer existed. And we really want to make sure that we're able to contact families in case of an emergency. So there's more things that are in this booklet that are necessarily health related, like the school messaging consent form, the media consent form, family income form. But a lot of it does have to do with health. And I think possibly the next slide, definitely if you can move to the next slide. Yeah, thank you. There are some optional forms that are contained in that program, which can offer some much needed services to our families. We have dentists, school-based dental services, and school-based vision services. So these are actual dentists, actual eye doctors that can come out to the schools and perform examinations. In the case of the dentist, they will do the dental exams that are required in school for certain grades. It's required in kinder, second grade, sixth grade, and for high school entry. And they're able to do that exam. If the child needed actual dental work, they would refer them out for that. So if they needed to have some cavity work or other kind of services, they would provide the parent with a referral for that. And this is provided at no cost to the parent. So what is needed if you were interested is just simply to fill out that vision consent form. The dental consent form, but the same thing goes for the vision consent form. It's also actual eye doctors that come out to the schools. They can perform a thorough eye exam. If your child needed glasses, they would be able to order those and provide them at no cost to the parent. And I don't know if everyone's aware, but a vision and eye exam is actually a school requirement for kindergarten. And just best practice, it's a good idea to get your vision checked, especially if you have glasses or have worn glasses in the past, to have that annual eye exam. And this can certainly go a long way to help parents get that much needed services done for their children. Another way where that can be helpful is for loss of glasses. Sometimes our insurance companies do not always pay for more than one pair of glasses a year. And children tend to break or lose glasses frequently. So this vision, school-based vision services can come really, really in handy. And of course, a child who can't see may have some trouble learning. So it really is important. It's an optional service. It's here to help families. It's not something that is absolutely required. If you have an outside provider, you're more than welcome to use them. But this is something that's offered as a resource for our families. Next slide, please. Okay, so what is required that we actually need, like in the schools, is this the dental exams. Again, I said what grades they were necessary for. Preschool, kindergarten, second grade, sixth grade, and high school entry. The vision exam report are for those children. It's a requirement for children entering into kindergarten. And of course, if you needed glasses, you should get it done on a yearly basis. Asthma action plan, we take asthma, food allergies, diabetes, really any health issue that a child has very, very seriously. We want to make sure that we're supporting the child in school, that we're ensuring that they can access everything that other kids can, and that if they needed any accommodations, that we're meeting those accommodations. So we really do ask for an updated asthma action plan on a yearly basis. Children are allowed to carry their inhalers with parental consent. But that asthma action plan is just like that added step for us to ensure that we're keeping children safe. There is also food allergy plans. And if your child has a food allergy, what would be a key really to supporting the child in school is that have that healthcare provider statement for food substitution. That allows us to provide them with a substitute. So if they're not allowed to have peanuts, then we can provide them with that peanut-free diet. But it does have to be completed by the physician. And the forms are contained in this booklet. If you did not receive the booklet, you can always reach out and ask the clerk for the booklet, or reach out to the school nurse and make sure that you have all the forms that are needed. Next slide. Okay. And a lot of the paperwork right now, I'm living it. I'm bombarded in all the forms of for our medical requirements. The state actually requires us to have certain documentation on file for our students. And that's a current health exam in key grades. Our grades for the health exams are preschool, kindergarten, 6th grade, and 9th grade, or anytime you're entering school for the first time. These health exams it's a specific form from the state of Illinois. It lists immunizations on the back part of it. The physician can outline if there's any emergency plans, if they wanted anything specifically done to accommodate the child. We do ask for more specific guidelines, but this is a good jumping start for us as nurses to be able to reach out to families and like get a little more information or see like what else can we do to help accommodate the child so that they're successful here in school. Immunizations, there's specific guidelines and I really cannot like memorize and like let everyone know all of the requirements, but we do have the requirements that are put forth by the state of Illinois. They're usually correspond with our grade levels for physicals. So in kindergarten, there are certain vaccines that are needed. For 6th grade, there are certain vaccines that are needed. So it kind of corresponds with that. We are by state law supposed to have, well, we're aiming for 90% or greater for immunizations. To have our children in compliance. And that number actually corresponds to like what would be, what makes a disease or what would lessen the risk of a disease spreading in a community. So we have over 90% of our children compliant with immunizations. We're pretty much reducing our risk that that disease will come up in the school. So it's really, really important for us to have that accurate information. Oh, thank you, Ali. Yes, there's a link there to all the medical forms. So once we receive those forms, it takes quite a bit of time for us to go through them and enter it in our computer, the follow up. And sometimes we do find that there's a mistake, that there could be an error or possibly a vaccine wasn't written down on the physical. So we may be reaching out and sending other letters home asking for that to be, the documentation to be submitted to school. So you might be getting some additional letters from the school nurse. Let's see, can we go into the next slide, Ellie? Oh, I think this is kind of what I was talking about. Yes, October 15th, that's the magical date. And that is the date that's put forth by the state of Illinois. It's actually in the school code, in the law, that schools have the option of excluding children who are not in medical compliance. There are two two acceptable reasons in Illinois for you not to meet the immunizations, or if they have a waiver for immunizations, that is a religious waiver. And that requires a specific form from the state of Illinois where a parent can outline what is the belief, what is the specific vaccine that they are opposed to. And there's a section there for the physician to sign off on. The physician is not signing that they're in agreement or anything like that, just merely that they are aware and they have discussed the risk of this decision. So it's not like you need the doctor's approval. You just need to have some proof that, yes, a doctor has counseled on this. We also accept medical exemptions for vaccines, and that is a child who has some kind of a health condition in which they cannot receive that vaccine. So that would mean a child who is perhaps allergic to a part of the vaccine, an ingredient in the vaccine, or if they are immunocompromised and cannot receive certain vaccines, that would qualify for a medical waiver. So those are our only two exceptions. Everybody else, we pretty much expect that they're meeting the guidelines set forth by the state of Illinois and based on the CDC. Okay, alrighty, I think we said all of that. Next slide. There's a simple list of all the vaccines. There are so many of them. The nice thing is that they are given in sections. So it's not like it's one by one. Oftentimes we are able to have like the MMR and the varicella in a combination. So that's like one stick instead of two sticks, or actually four sticks could be if you were giving it all individually. So it is quite a bit to go through, but if you're following up with your pediatrician, this is pretty much the guidelines that we're all using, that the pediatricians follow as well. You can move forward. Okay, so the flu vaccine is one of the ones that are recommended but not required. That means that it is, we are not going to exclude a child if they're missing their flu vaccine. It's not something that they absolutely must bring proof in, but it is something that we feel is really going to be helpful. It can help prevent disease. It's a proven thing. The HPV vaccine as well, that is it's preventative for cancer, and it can be given at the ages of 11 to 12, like well before the child is really at risk for these kind of conditions, but it can be very protective. It's it really is a good idea. It is not a requirement, but if you do have it done, by all means, bring in that proof, that immunization to the schools, and we'll make sure that the records are reflective of that. And of course, the COVID-19 vaccines. Now that is, again, not required. It is recommended. It has a lot of impact right now based on guidelines for sports participation, guidelines for quarantine or whatnot. So please, if you have the vaccine done outside, please bring a copy into the school for the school nurse to enter and review and make sure that we have that on file for your child. Next slide. Okay. Yeah, this was what I was alluding to before about the oral health program, where they do the examination, the cleaning, fluoride treatment. So all of this kind of non-invasive sort of treatments can be provided right there at the school. And if there was more intensive work needed, it's referred outside. So this is really for children who do not have a dentist or perhaps are underinsured for dental care, and that can be very, very helpful for them. So the vision program, I think I spoke to it before. We do have school-based vision services, so they'll come out to the school, and there is also some outside places where you can take your child in and get these services provided. Some parents do feel more comfortable if they're there present and totally understandable. And if that's the case, the Illinois Eye Institute will be able to provide those vision exams and glasses if needed at no cost to the parents. All right, asthma. That is, Chicago is really one of the epicenters for asthma. We really want to make sure that our kids are supported in school and that they're as healthy as can be. So to try to make sure that we are on top of this, we do ask for the asthma action plans to be turned in on an yearly basis. It's sometimes I've seen parents turn the forms in and they have filled it out, which is helpful, I think, because it's great if you know your child's triggers, if the child knows their own triggers, all of that is awesome. But we're really asking for the physician's input on this. What does the doctor think the triggers are? You know, have they done the allergy testing? Can they say, you know, what specifically environmental allergies that they have that may trigger asthma? So it really, we do ask for that to be filled out by the physician. The medication, the self-administration medication form, that's also one that gets filled out by the physician. And then there is a parental consent. If for whatever reason your child has asthma and you have not been able to get out to the physician, you can bring in a copy of the pharmacy label and the parental consent in writing, and that is enough for your child to carry their inhaler and have their inhaler on their person. Next. Okay, so food substitution. I had mentioned it a little bit before, but I think I mentioned it more in regards to food allergies. It also is available if your child has a food intolerance. So I think our most common one that I see is lactose intolerance. Because that could be really uncomfortable for a child. And there's a milk there provided, there's pizza, and there's all these things that can set it off. So if you have the documentation from your doctor, ask them to fill out that form so that the lunchroom is able to provide that substitution, a substitution for the milk. Alrighty. Okay, next. Okay, medication administration in school. So what I was referring to earlier for allergies and asthma, all of those are emergency kind of medications, but sometimes a child does need to take a prescribed medication at school, or even if an over-the-counter medication, if they have like headaches. And let's say I've had children with a diagnosis of migraines, and the doctor will prescribe medication to be sent to school and used as needed. We do, whether it's prescribed or over the counter, we do need to have the doctor's written authorization. That lets us know what is the condition, what possible side effects we need to monitor for, and exactly what is that dosage that the child is to have. So we need that in writing from the physician. And then we need, of course, the parental authorization as well. The next thing that is necessary is for that medication to be sent from home to the school. So if it's over-the-counter medication, just send it in from home in its actual original container. And we would write out there, put a label on it if it's over the counter with the child's name. If it's a prescribed medication, it does need to be in that pharmacy labeled bottle. That's very important. It's not just one child. There's oftentimes multiple children taking medications at school. Sometimes the medicines may look very similar. It's just to be absolutely safe, we do need to have everybody with their own labeled, written out very clearly, you know, what is the medication, what is the child, and like who is the child, and have all of that match what is on file from the physician. Just a matter of safety again. What else? Sometimes I do see where a parent will just bring in their own requests, and please understand that as nurses, we are not, under law, we cannot administer medication without a physician's order. So we cannot administer it if we do not have that medication order from the doctor. And we'll work with you if you did need to have that signed, and perhaps you don't have an appointment till next month or whatnot. There is, you can give us a release to speak to the physician. I don't know if that's in your slideshows here, Allie, but there is a release of medical information that can go out, and we can specify it that is to follow up on asthma, to follow up on food allergies, to follow up on medication during school hours. And then we can like follow up with the doctor then and obtain that authorization. So if you have any questions, any doubts about the medications or about your child's medical conditions and how we are able to accommodate your child in school and get the best plan in place, speak to your school nurse. To work with your school nurse, we're more than willing to work with you. We'll help out as much as possible, reach out to that physician if it's needed, and make sure that we have a plan in place for your child.
Thank you so much, Cindy. I did throw the exchange for medical information in the chat just now. I've also thrown some other stuff in the chat. Some great information about vaccines and vaccines catch up in English and Spanish. All the links I've put in are both in English and Spanish. I've also thrown in the link to our health requirements by age. So you kind of saw on each slide, we broke them up one at a time. This is like the big picture. So we've posted those both in English and Spanish for you as well. We just wanted to take a few minutes to talk about this website. I threw this in the chat as well, CPS.edu/medical forms. This is where all of so Cindy kind of talked through the big pieces of the booklet, which has the general stuff that's for everyone, plus asthma information if you have asthma, allergy information if you have allergies. We also posted here because some of the stuff is very specific. Students with diabetes need special forms filled out. Students with cardiac conditions can have a special form filled out. Students who get PT and OT need an additional form filled out. Some of our pregnant students, our nurses can use this form to help manage those. Same with seizures. Our sports physical is on here. So what we've made this is a repository of every form that may need a physician's signature. So at the top of the page, you'll see when you go here, it links to the big booklet. So you can print it out yourself. You can fill it out on the computer if that's easier for you. And then if you click on each one of these links, you can download any specific form that you may need. If your child is a diabetic, all of the diabetes forms are in that section. The other thing I just want to call out is often the forms say physician, and even we say it, oh, I need a physician's order. That's not necessarily, when we say physician for schools in Illinois, we do not mean someone who has, who's a doctor, who has an MD or a DO, is a doctor, like a medical doctor. We also accept advanced practice registered nurses and physician's assistants. So it's not, not everyone can write these prescriptions, but it is not just a doctor. It is also our advanced practice registered nurses and our physician's assistants. So if you see one of those, or if they're the people who fill out the forms at your practice, no problem. We'll accept all of your paperwork. Also just wanted to talk to you about a unique resource that we offer here at CPS. If you're struggling to get connected to insurance. Insurance is complicated, transparently. And we know that insurance can sometimes limit our access to get care. We never want that to be a case for any of our kids here at CPS. So unlike, and I don't know, there are very few school districts across the country that do this. We have in-house here at CPS a team of people who will help fill out forms so that your child can either get Medicaid or SNAP benefits. So if you need supplemental nutrition assistance or low-cost insurance through Medicaid for your children, you can reach out to our Children and Family Benefits Unit by calling 773-553-KIDS. They're an amazing group of people. They speak Spanish. They are very knowledgeable, and they will meet one-on-one with families to make sure they have the right forms. And those forms are going to go directly to the state. Our families never have to wait in a line. They get to skip the line and go straight to the state. Also, so you've got insurance now. What do you do with it? You need to get these forms filled out. I highly encourage everyone to use this website called Find a Health Center. It is looking for any federally qualified health centers near us. They are great resources. They legally have to be affordable. That's why they're federally qualified. If you don't have insurance, they will still accept you and allow for a sliding scale payment. They are some of our great resources here in Chicago, and you can see from a map, we have quite a few of them. We also have school-based health centers inside some of our schools. And so those schools, if you go to, Simpson Academy, you can go to a Rush school-based health center in your school. So those are some great resources, and we just wanted to open this up for any questions. And you can ask your questions in English or in Spanish. Cynthia is a fluent Spanish speaker, so she can also respond directly.
So I will allow parents to kind of think for a couple minutes. So I have a couple questions while parents think a little bit. Just hypothetical. The first one is, what is the rationale behind having dental and vision form, or like for entrance into kindergarten? Because I think some parents might say, well, it's just dental, like what's the big deal? Why is that required? Or, it's just vision, if I'm taking care of that, why do you guys need to know, type of thing?
So these are actually state requirements. They aren't CPS requirements. These are state requirements for physical exams, for vision screenings. All of these are put forth by the state. And so in order to be in compliance, we need to ask them. But more than that, we need to know who's done it so that we can support those who haven't, so that we can find the families who are struggling because they don't have a dentist, or they don't have insurance, or they don't know how to get their eyes checked because transportation's hard, right? So by asking everyone to submit these forms, this allows the district to reach out to the families who need more help and provide that service to them directly. So not only is it a state requirement that we ask for them, but it allows us to target our interventions to help those who it's hard for. So we asked everyone so that we can help those who need help.
Thank you. And then the other question I had was, you talk about the prescription medications that need to be in a bottle. So, for a medication that's as needed, are parents allowed to, like, if, they need some for home, what's the process would you suggest they suggest that they take some out and keep some at home? Do you suggest, can they take out?
That's a really good question. I have had this come up, and I'm glad you brought it up. And it's, I think, a little bit tougher when it's a prescribed medication, because what if the pharmacy only gave you one bottle? Like, what are you supposed to do? And what I've recommended is just like when you get this prescription filled, is to ask the pharmacy to provide a bottle for school. And really, you have to say a labeled bottle for school, because I've seen them just give an extra bottle and like, okay, it's not labeled. That's not going to help me at school. Who is this for? But they will provide you with a second labeled bottle for school. And yeah, if it's an over-the-counter Yeah, we do ask that you send us the one in writing, the one that actually has the original
The label.
container.
Yes.
Yeah.
Okay. So are there any other questions? If not, that's okay. And I will close out. Is there anything else from Cindy and Allie?
I mean, I will, since we're talking about health, right, and health forms. I know that the COVID vaccine, there's a lot of questions about that. So I just want to take a couple minutes to go a little deeper. As Cindy said, this is recommended but not required. We really encourage our students to get vaccinated. Our staff is being required to be vaccinated unless they have a religious or a medical exemption. Our students at this time are not. That's in alignment with the state law. The state law kind of tells us what we can require and what we don't require. And so right now, you know, there isn't a requirement at the state for children to get COVID vaccinated. But it's a really good thing because it prevents, not only it decreases the likelihood of you ever getting COVID, but it's very, very, very effective at preventing, if you happen to get COVID, if you happen to be a breakthrough case, hospitalization and death. So it's a powerful vaccine in the fact that it saves people's lives. Now for our kids, right? Children do tend to have less, they're less likely to get COVID, but right now we're seeing that they're the only people who are left unvaccinated, right? Those under 12 who don't qualify for vaccine. So this is just a thing that I tell my own family. It's called cocooning. And it means that those children who are under the age of 12 who don't qualify to get vaccinated, our goal should be to surround them by vaccinated adults. So this means in your house, if you can get vaccinated, at our schools, we've required our teachers to get vaccinated and our staff to get vaccinated, because if we can surround those who are under the age of 12 who don't qualify, right? They're not eligible to get vaccinated by vaccinated adults, we're going to cut down on their risk significantly. So it's like wrapping them up in a blanket of vaccine, right? They themselves can't get vaccinated, but we vaccinate everyone around them. So just as a pitch, I know vaccines are scary. I personally hate getting shots. I'm a nurse and a grown-up, and I can't imagine being, 8 and 9. I definitely didn't like shots then. But these vaccines, whether it's the COVID vaccine, which is highly recommended and encouraged, or, the chickenpox shot, vaccines, the reason that we use them and that they're so important is it can prevent us from getting sick, and it can protect those who can't protect themselves. For like chickenpox, right? Sometimes littles, right? When they're very small, they can't get vaccinated. We want to protect them by surrounding them in vaccinated people. And so I just encourage, we know this year has been crazy and that getting to healthcare is hard. We try to make this as easy as possible. The Find Your Health Center is a great resource. But also we bring vaccines to schools. You might get a reach out from your school nurse saying, hey, the vaccine van is coming to your school, sign up. Feel free to sign up, use your school-based health centers. I like to say Chicago has a lot of resources, but sometimes they're hard to connect to, right? Depending on your neighborhood, depending on how you travel, right? If you only take the bus, some things are harder to get to. We know a lot of resources, so use us. Ask us questions here, even if it's about a personal thing, throw it in the chat. Reach out to Kelly afterwards, and Cindy and I will follow up with you directly. We are grateful that you're here and that you've come to learn, but we also want to make sure that you're getting connected to care for yourself and your family. So reach out offline if you have any kind of more personal questions or just need connected to resources, because they're out there. Sometimes you just have to know how to look and how to connect with them. And that's something that as nurses, Cindy and I are very aware of, kind of how the system works, and we want to plug people in.
Thank you, Allie, for that. I think that the COVID vaccine is also very important for people to be knowledgeable about. And like you said, some people want it and they don't know where to go. So thank you. Are there any last minute questions? If not, I'm going to close this out for today. I'll say going once. And there we go. And if you need to contact the Office of Student Health and Wellness, I don't know why that's so hard for me to say today. If you need to contact the Office of Student Health and Wellness, there's the information on the screen. So again, thank you so much for joining us today.